Good morning. My name is Bart Stichman. I'm co-executive director of the National Veterans Legal Services Program, also co-counsel on behalf of 7 veterans who filed the class action that's the subject of this press conference today, SABO versus United States. We're here today to tell you about a court-ordered legal notice being mailed today to thousands of veterans who served in Iraq and Afghanistan and who developed post-traumatic stress disorder as a result of their service. The legal notice gives thousands of veterans the right to join this class action under terms that are likely to result in millions of dollars in additional monetary and health care benefits. We have 3 people here today to describe to you the important developments. As I mentioned, I'm co-executive director of the National Veterans Legal Services Program, or NVLSP, a nonprofit veteran service organization founded in 1980. In 2007, NVLSP created a new project, Lawyers Serving Warriors. Lawyers Serving Warriors provides disabled veterans and active duty personnel free legal services to help them obtain the federal government benefits they need and deserve. These free legal services are provided through a nationwide network that we have developed of over 70 law firms, private law firms, and corporate law departments. Lawyers Serving Warriors focuses their legal representation on those who served since 9/11 in Iraq and Afghanistan. After we launched Lawyers Serving Warriors, many veterans who served in Iraq and Afghanistan and were discharged by the military for post-traumatic stress disorder, or PTSD, came to us for legal assistance. In reviewing their military records, NVLSP discovered that the military services were systematically violating the rights of these veterans to important monetary and health care benefits. We turned for help to the private law firm Morgan, Lewis & Bockius. Morgan Lewis, by far, is the most active of the over 70 law firms participating in Lawyers Serving Warriors. In terms of the number of hours its lawyers in cities around the country have devoted to free representation of disabled veterans. Morgan Lewis agreed to serve pro bono for free as lead counsel with NVLSP in a class action lawsuit to challenge the systematic violations of law occurring to veterans discharged for post-traumatic stress disorder. Jim Kelly, at the end, one of the lead attorneys for Morgan Lewis litigating this lawsuit, will provide you with details of the class action and more information on the court-ordered legal notice that is being mailed today. The class action SABO v. United States was filed 13 months ago. There are 7 named plaintiffs. All 7 veterans served in Iraq or Afghanistan were ultimately eliminated from service due to PTSD without the monetary and health care benefits to which the law requires that they be provided. One of the 7 named plaintiffs, Marine Corps veteran Tyler Einerson, is here today to explain what happened to him during his service and the importance to him of today's developments. Over the last few years, there has been much news in the media about the prevalence of PTSD in those who served in Iraq or Afghanistan, and about the problems they have encountered in getting proper medical care and appropriate government benefits. Let me make clear at the outset what the legal notice being mailed today does and does not involve. It does not involve the reported problems these veterans have had in getting the government to properly diagnose their mental disorders. Nor does it involve the reported difficulties these veterans have encountered in getting VA disability benefits for their PTSD. Rather, the court-ordered legal notice is being mailed today to more than 4,300 veterans who were diagnosed in military service with post-traumatic stress disorder as a result of their service in Iraq or Afghanistan. Not only did the military services diagnose these veterans with PTSD, they convened a physical evaluation board which determined in each of their cases that the service member's PTSD was so severe that it rendered them unfit for continued service. The nature of the systematic government mistreatment addressed by our lawsuit is that when the military services discharged these veterans due to PTSD, they denied them military benefits to which they were entitled as a matter of law. The benefits we are talking about are lifetime military, not VA, disability retirement benefits. These benefits include those listed on this poster: free medical care for the veteran and the veteran's spouse for the rest of their lives, free medical care for the veteran's children until they become adults, and monthly monetary benefits for the rest of the veteran's life. But to be entitled to these disability retirement benefits, the law requires the military to determine that the conditions which rendered the service member unfit for continued service are equal to or more than 30% disabling, using the VA disability rating schedule. This is widely known as the 30% rule. The VA's disability rating schedule says that anyone who suffers from post-traumatic stress disorder that's so severe to render the service member unfit for continued service must, I repeat, must be assigned at least a 50% disability rating. The practice of the military services challenged in our class action was not to follow this rule. Instead, the Army, Navy, Marine Corps, and Air Force all regularly assigned disability ratings for PTSD of less than 50%, in most cases less than 30%. Indeed, many of these veterans were assigned ratings of 10% and 0% for PTSD, even though they were told at the same time that their PTSD was so severe that they could no longer continue to serve in the military. Thus, over the time period covered by our lawsuit, since December 2002, over 4,300 veterans were assigned a less than 50% disability rating, leading in most cases to denial of military disability benefits